Who wins for lowering cholesterol? 4 Brazil nuts or statin drugs? What do you think, class? I wouldn't be sharing unless it was something that was helpful with Brazil nuts. But here's the actual study. They took volunteers and they gave them just 4 Brazil nuts. And then their cholesterol was monitored for 30 days. So one time, eating 4 Brazil nuts, watch your cholesterol for 30 days. And what happened? LDL went down significantly. That's the bad cholesterol. And HDL, the good cholesterol, went up. And these weren't mild changes. LDL dropped a lot, and HDL came up significantly. When you lower LDL, you lower your risk of heart disease, so this was important. And their LDL was lower in 9 hours. And it continued to go down for the next 2 days. Now, if you take a statin drug, it's going to take 4 days for your statin drug to lower your cholesterol. And how long did it stay down? That's the real question. All right, it lowered it, but how long did it stay down? For 30 days. Now, if you take a statin drug, there are some positives. It blocks the production of cholesterol in the liver. It decreases cholesterol going into the arteries. It has an anti-inflammatory effect, which I believe is the biggest benefit of all. And it does slightly reduce your risk of cardiovascular problems, but only 1.7%. How about the negatives of a statin? Decreased HDL, so your good one goes down and your bad one goes down. Muscle pain in some patients can be significant and permanent. You are likely to forfeit all the benefits that you're putting into exercise on a statin. It lowers your CoQ10, and you should never take a statin without taking CoQ10 because that puts you at risk for a heart attack. Your diabetic risk goes up 9%, and they're connecting more and more mental issues and memory loss with statin drug use. How about the side effects of those 4 Brazil nuts? Nothing, only good things. So the conclusion of the study, a single serving of Brazil nuts can acutely improve lipids. There's also studies that show Brazil nuts and other nuts help you lose weight, which is a good side effect. Reduce your risk of diabetes, metabolic syndrome, and heart disease. And my favorite nuts are macadamia, walnut, almonds, pecans, and of course, Brazil nuts. So I want to encourage you to eat nuts daily. You should eat a small handful every day. And if you have cholesterol issues, you should be using some Brazil nuts. If you like this video, please hit the share button.